Welcome to the Lady Boss interview series. I'm Kat McDavitt, and I'm interviewing women leaders in the healthcare industry about one big thing. In this episode, I had the fortune to interview Dr. Cerise Elliott. Dr. Elliott is a program director for the Clinical Interventions and Diagnostics branch of the Division of Neuroscience at the National Institute on Aging. Dr. Elliott tells me about her one big thing, increasing diversity and representation in research, and talks about how having courage and cold calling local universities as a high school sophomore in Omaha put her on the path to completing her Ph.D. in neuroscience.
Thank you for having me, Kat. What I really, I always had good teachers as a child, and they were very interesting, and they were always like, science is fun. And I just kind of led through that, because when you find interesting people you want to follow. And then later, I wanted a work opportunity. So I cold called the university and I asked to work in laboratories. And I was able, as a sophomore in high school, to develop my own scientific project.
Really?
Yeah. And
That's
you're
awesome.
kind of learning like the scientific method as a high school student, and as a college student. I met I networked as a high school student, because here I am, this brown child, and as a sophomore in high school in a laboratory. And so they were really interested in kind of retaining me. And so I ended up going to that university for school. And again, following teachers who were interesting. One of the professors in the chemistry department had a musicochemical manifestation where he would do chemical demonstrations for all the elementary schools. And it was a really interesting way to sell chemistry, how chemistry is fun, in an elementary kind of manner. And I joined him for like 7 years teaching elementary kids chemistry. And I became a chemistry major because of that teacher. And also I started working in the laboratory at the local medical center, and I did some AIDS research, cancer research, and I ended up doing multiple sclerosis research, where that professor allowed me and invited me to do a PhD program with her after I finished my chemistry degree. And I agreed, because it was a good time that I had. So I spent 5 years at the Nebraska Medical Center doing my PhD in neuroscience, and I'm studying multiple sclerosis and the immunology behind that science. And, after kind of following the teachers and following different ways, I wanted to figure out, what can I do outside of the laboratory? And there's always in grad school this discussion of alternative careers if you don't want to do the next step of a postdoc. And I learned about technology transfer and patents and lawyering. Lawyering was like an option if I wanted to go to law school. And but I ended up meeting individuals from the National Institutes of Health. They had an office of technology transfer office, and they had postdoc positions there. So I graduated my PhD, and I ended up at NIH for a couple of years doing technology transfer policy. Then I transferred over, and because now you're in DC, you learn about scientific policy. And then I ended up as a program director at the National Institute on Aging, and I've been there the last 13 years.
Wow.
And I manage the Alzheimer's disease research centers. They are large programs of consortia that work on Alzheimer's disease research in different states across the country. And currently we have 33 of those centers. And I also managed, for the time, health disparities research and health equity research in Alzheimer's disease research. So
that is so cool.
Yeah, I've had a good adventure and kind of, like I said, followed the right people and kind of made the right choices.
Yeah, it sounds like you had so many people that inspired you and helped you out. But I mean, it's not just luck, right? You mentioned that as a sophomore, you cold call a university because you were so interested in the field. I think that's amazing, and it sounds like you did a lot of that networking on your own. So it's very cool.
Yeah, it's a good skill to have. Networking is like the number one. Like any kind of pivot you want to make, it's all about like who you know.
Yeah, and it sounds like that's how you've gotten to where you are, because it's not a huge diversion, right? But I mean, Alzheimer's research, health equity research, and policy, and it sounds like you had people that kind of guided you that way, that you actively networked.
Yeah, and definitely provide. I'm in the right place at the right time, doing the things that I wanted to do. I mean, one of the things that as I was interviewing to become part of the National Institute on Aging, was I was in the middle of caring for my grandfather who was going through the end of stage. So it's kind of one of those things where you think the universe is kind of speaking to you, like, oh, you're going to this National Institute on Aging and it's studying Alzheimer's. And they just put out like this really beautiful booklet about end of life. And it's a public kind of book about how to make choices and a little bit education of what we all should do for end of life care. And that's that communication product that was there. So all of those like clues and things were like telling me like, this is the right job for myself. So, yeah.
That's very awesome. Very cool. And so now you're doing some, what looks like to me as a layperson, pretty intense research on Alzheimer's, and combining that with your background in health equity. So can you talk about, you mentioned you were leading health equity research in your field. How did you get into that? And then how has that shaped what you're doing now? It's a huge issue in our industry right now. And I feel like we were joking earlier, no one really quite knows how to describe to you what health equity is.
Yeah, it's what my primary role at the National Institute on Aging is to manage grantees who get federal dollars for research. And in our division, we're in charge of funding Alzheimer's disease research. And for the last 9 years, we've have gotten a special appropriation from Congress specifically for Alzheimer's disease. So our budget has increased like 4 times in the last 9 years. And we currently have a budget of $3 billion to help solve and cure Alzheimer's. And there's a national Alzheimer's project that we operate under. And in having these new appropriated funds, we kind of created a health disparities in Alzheimer's disease special interest topic to allow people to for these applications, and that we're accepting these applications. And so the research investigators across the country are coming in and sending in their applications to study Alzheimer's disease and the and how can we equalize the representation in studies?
Yeah, yeah. So what are the steps to do that? So I know you're talking about the grant recipients, right? Making sure that that those that are selected are representative, right? But what other tools are out there to increase representation?
I think that what we need to have are more approaches in which we're bringing science out into the community. I think that the institutions that do the scientific research kind of have the pathways that work, and they kind of keep those pathways working, and they don't want to create something new to get a new audience or a new community involved in the research. So, if I need 100 people and I can get 100 people quickly this way, I'm going to keep doing it this way.
Got it. Okay. Okay.
So I think we need to incentivize, the branching of new opportunities and new communities into our research.
Got it. So it's the path of least resistance problem in some cases, is that I need this fast and this works, so I'm doing it, even if the outcome is not necessarily addressing some of the health equity issues.
Most definitely.
Got it. And then you think outreach and just making sure you're getting science into the community is another path to be helpful.
Well, I mean, one of the things that you're talking about also is sometimes like the budget is kind of like the way forward. So, if your personnel is low, or, the institution isn't providing you enough resources, saying that, of course, I'm going out into the community, but you only do it once a month and not once a week, or you meet with the same 10 people and not, the 10 people of those 10 people, so that you have 100 people. So if you're not actively broadening, your outreach and, committing money to and people to the process, then, that's a real kind of, situation that limits the way that recruitment happens.
Yeah, that makes sense. So what has been the community response to the piece you wrote in JAMA? I mean, are people receptive? Are more ideas coming? What's the kind of the environment right now?
I mean, I think the environment is hopeful. I feel that there are opportunities for researchers to be mindful of who they need to recruit and why. But also I think they're coming against the idea that it's not easy, and they're getting a lot of resistance, as we kind of described earlier. So people, again, have to be creative and make new pathways into outreach. And that is something that doesn't happen within a 5-year project period.
Right.
These are
things the challenge
that,
too, right? The typical project timeline, right? Might not be conducive.
Yeah. And these relationships usually take decades, not a year or 12 months. Like, it needs to be a persistent kind of relationship between institutions and the communities in which they serve.
Right.
I mean, I know, certain areas, they have certain hospitals that feed certain parts of the community, but, when they do research, they're looking outside of the community that they serve, because the community that they serve isn't, research worthy, or they don't know how to talk to them about research. So I think there's a lot of, specialized, selective kind of decision-making that of who you're outreaching to can, limit the representation of studies.
Got it. That makes a lot of sense. That's interesting. There's a lot of barriers, but I think back to what you're saying about incentives, right? Making sure that it's known, a known issue, and incentivized might help at least a little bit to start. That's awesome. So, in our world in healthcare policy, there's so much out there about making sure health equity is top of mind, and that it's written, even into a lot of the technology vendors, what they have to collect, making sure that priority populations are represented. What do you think of the whole trend? Because it's a little buzzy these days, right? And I think sometimes it gets lost. So, what does health equity mean to you?
I mean, I feel sometimes these phrases are very difficult to operate with. Health equity to me, it equals representativeness. Like, I could open up the demographic table of a study and see that, the collection of participants, are equal and they're not skewed in one way or another, that everyone got an opportunity to kind of be part of the study. But also health equity means, not just the participants in the study, but also being inclusive in the researchers that are part of the study. Because diversity in researchers also brings diversity into science, and the questions and the research questions that people ask about a certain disease or a certain question about science, or even the health policy. Because if you're not, I'm in Washington, D.C., and if you're not familiar with, Ward 8 of DC and the shortages that they have and the disinvestments that they have, and you're not familiar, with that, you won't make them a priority because, you're kind of into your where you are in Ward 6 or Ward 5. And so it's making sure that all of the pieces are accounted for.
Right. I love that. That's awesome. And we're running out of time, but I did want you to comment. So I know you're from Omaha. A mutual friend may have told us. And also you were the captain of the debate team or the speech team. What is the story with that?
I mean, as a kid, I thought I wanted to be a lawyer, and I thought that, speaking would be a good skill to have. And our mutual friend is just very boisterous, and extemporaneous speaking was like a great skill that we both had. And that was just an excellent opportunity for, 3 or 4 years to travel around the state and compete in extemporaneous speaking. So,
I love that. That's awesome.
I would have to walk around with my Newsweek magazines and having all, I had to collect all these primary references and things like that for that. So it was
look
amazing.
At you now. That's
Yeah.
awesome. Well, anything else you wanna leave our listeners with?
I mean, I think that it's important that we look to examine, the structural racism that happens within our society and how it affects our science, and the way that we are treating members of society are also, affecting their health. And those questions need attention.